My name is Rosalind Owen. This is going to be my head-to-toe assessment for the University of Memphis for the summer 2023. I'm going to go ahead and scan the room at this time. There's my supplies. And then I'm going to scan the floor. Throughout this head-to-toe assessment, I will be assessing the skin for color, warmth, moisture, edema, temperature, texture, turgor, bruises, scars, lesions, and nevi. I'll be assessing all of this in the head, the face, neck, anterior, posterior, the chest, abdomen, and in my upper and lower extremities as well. Starting off with the head, I'm going to go ahead and inspect, checking for hair, color, texture, distribution. I'm going to go ahead and palpate the scalp for any tenderness, masses, infestations, indentations. I'm going to go ahead and palpate the temporal arteries for tenderness. Moving on to the lymph nodes, I'm going to go ahead and assess preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Moving on, I'm going to go ahead and palpate for TMJ, checking for subluxation, crepitus, and tenderness. I'm going to have the patient open and close his jaw. Good. Moving on to cranial nerve 5, trigeminal for the motor part. I'm going to have the patient clench his jaw as I palpate the masseter muscle. Good. For the sensory part, I'm going to have the patient close his eyes. And I'll be, I want you to tell me where I touch you, okay?
Forehead, chin, right cheek, left cheek, nose.
Good. Alright, moving on to cranial nerve 7, which is the facial nerve. I'm going to have the patient smile, frown, raise their eyebrows, puff their cheeks, pucker their lips. Good. Moving on to the ears, I'm going to go ahead and inspect the outer ears. Go ahead and palpating the tragus and pinnae for any masses or tenderness. I'm going to go ahead and grab my otoscope, and I'll be checking the auditory canal and the tympanic membrane, checking for any discharge. Good. And I'm making sure to pull the auricle up and back as well. Alright, now moving on to cranial nerve 8, which is the acoustic nerve. I'm going to be assessing the whisper test, the Weber test, and the Rhines test. So I'm going to have the patient cover up one ear as I whisper 3 words to him.
1, 2, 3.
Perfect. Other ear.
A, B, C.
Good. Now for the Weber test, I'm going to have place my tuning fork at the center of the patient's head, and I'm going to have him tell me if he can hear it equally on both sides.
Yes.
Perfect. Now for the Rhines, I'm going to place the tuning fork at the base of the mastoid bone, and I'm going to have him tell me when he can no longer hear it.
No. No.
Good.
No. No.
Good. And I would time this because air conduction should be twice as long as bone conduction. Alright, moving on to the eyes, I'm going to go ahead and inspect the eyebrows, eyelashes, and palpable fissures. I'm going to go ahead and pull down, checking the sclera and conjunctiva, checking for color, lesions, and discharge. Now I'm going to move on to cranial nerve 2, which is the optic nerve. I'm going to be assessing for central and peripheral vision first. So I'm going to have him hold a handheld Snellen chart, and I'm going to have him cover one eye and have him read the lowest line that he can.
L, T, F, P, H.
Perfect. Other eye.
L, T, F, P, H.
Perfect. And then for central and peripheral vision, I'm going to have him cover up one eye as well. And I'm going to have him tell me when my fingers come into his line of vision. Alright, you ready?
No. No.
Good. Other eye?
No.
Good.
No.
Good. Alright, moving on to cranial nerve 3, which is the oculomotor nerve. I'm going to go ahead, change out. Alright, now I'm going to have the patient just stare ahead. I'll also be checking for perla as well with my pen light. So just look forward. Good. Good. And then to test for accommodation and convergence, I'm going to have him stare at something behind me. Alright, now look at my finger. Good. Alright, assessing cranial nerve 3 again, oculomotor 4, trochlear, and cranial nerve 6, abducens. I'm going to have the patient stare at my finger, and I want him to follow my finger with his eyes. Good. And while I was checking the pupils, you want to make sure to check for red reflex as well, and the optic disc, making sure that it is sharp. Then moving on to the nose, I'm just making sure that the nose is midline, straight and symmetric. I'm going to go ahead and assess cranial nerve 1, which is the olfactory nerve. I'm going to have him close his eyes and tell me what he smells first.
Coffee.
Good. Now?
Overhead.
Good. Alright, moving on to nasal patency. I'm going to have the patient, you can open your eyes. I'm going to have the patient close one nostril and breathe in and out. Good. Other nostril. Good. And now I'm going to palpate the frontal and maxillary sinuses for tenderness. Is any of that tender?
No.
Good. Alright, moving on to the mouth. I'm going to be assessing the mouth, teeth, tongue, buccal mucosa, posterior pharynx, under the tongue, and the tonsils. I'm going to go ahead and check cranial nerve 12, cranial nerve 9, which is the glossopharyngeal nerve, and cranial nerve 10, which is the tragus. I'm going to have the patient open his mouth and stick out his tongue, say ah. Good. And I'm just making sure that the tongue and the uvula and the palate both rise symmetrically. I'm also assessing for cranial nerve 12, which is the hypoglossal nerve, making sure that the tongue is midline without fasciculations. Alright, and then moving on to the posterior of the chest, I'm going to have you angle your back towards the camera if you can. There you go. I'm going to be assessing the anterior and posterior of the chest for signs of respiratory distress, such as tripod posturing, retractions, use of accessory muscles, cyanosis, tachypnea. I'm also going to be assessing for any signs of deformity and symmetry as well. I'm going to be palpating for chest symmetry, so I'm going to have you take a deep breath in and out. Good. Now I'm going to palpate for tactile firmness, so I'm going to have you say 99 every time I touch you, okay?
99.
Good. Now I'm going to go ahead and percuss. Now I'm going to go ahead and listen to the lung fields, making sure that I get in the lower bases and laterally as well. So I want you to take a deep breath in and out, okay? Now I'm going to be assessing the egophony, bronchophony, and the whisper pectorique test. So every time I touch you again, I want you to say E, okay?
E.
Good. Now I want you to say 99.
99.
Good. Now I want you to whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. Alright, moving on to the anterior part of the test. You can actually turn around towards the camera. Same thing, assessing for signs of deformity and respiratory distress. I'm going to go ahead and palpate for chest symmetry again. So I'm going to take a deep breath in and out. Good. Now I'm going to be assessing for tactile firmness again. So I want you to say 99.
99.
Good. And now I'm going to auscultate slopes as well. Good. Moving on to the heart, I'm going to be go ahead and auscultating the 5 areas as well, using both the diaphragm and the bell of my stethoscope. So I'm going to be starting with the aortic valve, second intercostal space, the aortic valve, second intercostal space, right sternal border, pulmonic valve, second intercostal space, left sternal border, Erb's point, second intercostal space, lower left sternal border, tricuspid valve, fourth intercostal space, lower left sternal border, and then the mitral valve, fifth intercostal space, medial to the midclavicular line. Now I'm going to switch to the bell. So aortic, pulmonic, tricuspid, mitral. And I'm going to go ahead and find and identify the PMI. I would also make sure to auscultate for 1 full minute, noting the patient's rate and rhythm. So 60 beats per minute, normal sinus rhythm. I'm also going to, actually I'm going to have you recline the chair. And I'm going to have the patient recline at a 30 to 45 degree angle, and I'm just going to assess for any signs of JVD. I'm going to inspect for heaves and lifts. I'm also going to palpate the 5 areas again for any thrills, so aortic, pulmonic, Erb's, tricuspid, mitral. And I'm also going to auscultate the 5 areas again with the bell and diaphragm of my stethoscope. So aortic, pulmonic, Erb's, tricuspid, mitral, aortic, pulmonic, tricuspid, mitral. Alright, and for the safety or for the privacy of my patient, I'm going to keep his shirt on for the abdominal assessment, but I would make sure to assess for abdominal contour and symmetry. I am going to auscultate again for any bruise along the iliac, renal, femoral arteries. And now I'm going to switch to the bell or the diaphragm, and I'm going to listen to his abdominal sounds in the lower left right quadrant. Good. Now I'm going to palpate for any masses and tenderness, making sure to check the spleen and liver as well. Good. I'm going to go back and auscultate the carotid for any bruise as well. Good. I'm going to have you sit up real quick. And then for going back to the neck, I'm going to be assessing and palpating the trachea, making sure that it's midline and straight. Moving on to the thyroid, I'm going to have the patient tuck his chin and have him swallow. Good. Alright, and then I'm going to go ahead and assess the carotid. And we've already palpated, or we've already auscultated, so good. Now I'm going to check for CVA tenderness. I want you to tell me if this is tender.
No.
Good. Alright, moving on to the musculoskeletal. I'm going to go ahead and inspect and palpate the shoulders, elbows, wrists, hands, hips, knees, ankles, and toes, and I'll be assessing for redness, tenderness, any deformity, crepitus, or anything like that. I'm going to go ahead and assess capillary refill in the toes, and then I'll be assessing dorsalis pedis and the posterior tibial pulses. Good. Same thing with the fingers. I'm going to check capillary refill. Check the radial pulses. Good. Moving on to range of the motion of the fingers. So I want you to flex, extend, hyperextend, abduct, and then finger opposition. So I want you to touch each finger to your thumb. Good. Same thing with wrist. I want you to flex, extend, hyperextend, ulnar deviation, radial deviation, and then rotation. Good. For the elbows, I want you to flex, extend, hyperextend. Good. Then for the shoulders, I want you to flex, extend, hyperextend, internal rotation, external rotation, abduction, adduction, circumduction. Good. All right, now we're gonna move on to the toes, same thing. So I want you to flex, extend, hyperextend, abduct, good. For the ankles, I want you to plantar flex, dorsiflex, inversion, eversion, rotation, good. While I'm down here, I'm gonna go ahead and assess the strength of his extremities. So I want you to dorsiflex and plantar flex while I apply pressure, okay? Good, good. Moving on to the knees, I want you to try and flex, good, and then extend, good. Moving on to the hips, I want you to try and abduct, and then abduct, good. All right, for the hands, I want you to squeeze my fingers, good. And then for the biceps and triceps, I want you to try and pull, there you go. Good. Let me push you. Good. And then I'm going to assess cranial nerve 11, which is the accessory nerves. I'm going to have the patient shrug his shoulders against resistance. Good. All right. Moving on, I'm going to be assessing light sensation in the upper and lower extremities. So I want you to close your eyes and tell me where I touch you, okay?
Right bicep. Right tibial. Left bicep. Left tibial.
Good. All right. Moving on, I'm going to be assessing the deep tendon reflexes. So starting with the brachioradialis. Good. And I'll be assessing both of this in both extremities. Good. Bicep. Tricep. And then the patellar. Good. Alright, the Achilles. And then I'll be doing the Babinski in both feet as well. Good. Alright. Now I'm going to be assessing the cerebellar coordination. So I'm going to have the patient do a hand flop. I want you to start very slow, then go very fast. Good. I want you to do finger opposition, so touch each finger again to each finger. Good. And now I want you to touch your nose and then touch my finger. Good. Let's see. Alright, now I'm going to go, I'm going to have you stand up. Alright, I want you to try and touch your toes. And I'm just going to inspect and palpate the spine just for scoliosis. I'm going to go ahead and do range of motion in the lumbar spine. So he's already in flexion, so I want you to stand up. With extension, I want you to hyperextend, lateral rotation, and then rotation. Good. Now for the cervical spine, I want you to flex, extend, hyperextend, lateral flexion, rotation. Good. Now I want you to feet together, arms apart. Close your eyes. I'll be assessing the Romberg test. Good. You can open your eyes now. I want you to walk in a straight line. Good. When you come back, I want you to do heel to toe. Can't really see. Alright, good. Assessing the tandem walk. I want you to hop on one foot, hop on the other. Good. Now I want you to sit back down, and I'll be doing my tuning fork over the wrist. I want you to tell me if you can feel it, okay?
Yes. Yes.
Good. Over the proximal ulnar
Yes.
prominence. Good.
Yes.
Good. And then over the medial malleolus.
Yes. Yes.
Good. All right, and this completes my head to toe assessment. Like I said, for the musculoskeletal portion, we want to assess both sides, but for the sake of time, thank you.